Coolsculpting procedure is a groundbreaking method for the non-invasive removal of fat. It's most commonly used for unwanted bulges such as the abdomen, the love handles, and back. The procedure has been proven to remove fat safely without damaging or harming other body parts. Ideal patients are patients who are looking for treatment of localized fat bulges that are not easily reduced by diet or exercise. Coolsculpting is not a substitute for weight loss, obesity, or patients contemplating surgery. Patients should expect a reduction of localized fat bulges in the treated areas only. Coolsculpting works by a mechanism called cryolipolysis. Cryolipolysis is the elimination of fat with the use of cold. This is possible because the fat cells are more sensitive to cold. This allows us to treat the tissue without damaging the skin, muscles, nerves, and other tissue. As a result of the cooling process, the fat inside the fat cells will crystallize. This will damage the fat cells, and over time the body will safely and naturally remove the fat and the fat cells through a process called apoptosis. The removal of the fat and the fat cells will result in a reduction of the thickness of the fat in the treated area. Once we have chosen the area or areas to be treated, I will then place the Coolsculpting applicator on top of the chosen area. After turning on the vacuum pressure, this will draw up the tissue up inside the applicator, exposing it to the cooling plates. At this point, you may experience a tugging sensation, which quickly dissipates once I've turned on the cooling process. The cooling process will numb the area, allowing you to rest comfortably during the procedure. Each treatment lasts 1 hour. The cooling process triggers an inflammatory process which results in the gradual removal of fat over a period of time. The lipids from the fat cells are slowly released and eliminated through the lymphatic system, much in the same way as fat from food. Because the fat is cleared by a safe, natural biological process, results are not immediately apparent. Some patients will begin to see an improvement in the body contour as early as 3 weeks, with the most dramatic results occurring after 2 months. Studies show that the body will continue to eliminate fat in the treated area for up to 4 months after the procedure. Coolsculpting is a non-invasive procedure. Patients can resume their normal activities immediately. Most patients will experience some redness in the area, which can last anywhere from a few minutes to a few hours. In addition, some patients can experience some temporary bruising, tingling, or numbness in the treated area, which can also last for several weeks. But in the vast majority of cases, this will not prevent you from going about your normal routine. The applicators have sensors embedded in them which provide constant monitoring of the treated area, ensuring consistent and uniform cooling. The sensors are linked to a control unit which is linked to a paging system carried by Dr. Brezel or his staff. Studies show that Coolsculpting will produce between a 20 to 25% reduction of fat in the treated area. It is possible to treat multiple areas in the same visit. During your follow-up visit, I will assess the area and make recommendations if additional treatments can produce further improvement if desired. Additional treatments of the same area can be performed and will produce cumulative reduction of fat in the treated area. Once we've reached our adult years, the number of fat cells we have in our body are stable. Changes in fat mass are a result of changes in fat volume, not the number of fat cells. Because Coolsculpting removes fat cells, results can be permanent as long as you maintain a healthy lifestyle and diet. The Coolsculpting procedure targets and eliminates fat and only fat cells. Other modalities such as lasers, radiofrequency, ultrasound, and liposuction may affect cells in other ways that Coolsculpting does not. Other procedures for fat removal, as mentioned above, may require a longer painful recovery period and entail risks not associated with Coolsculpting. There are 3 other non-invasive fat removal procedures currently available. The first one is Zerona. Zerona is a low-level laser, or what's called a cold laser, which means it doesn't produce heat. It works on the principle that the laser light produces holes in the fat cells, allowing the fat to leak out of the fat cells. Zerona, unlike Coolsculpting, does not destroy the fat cells and is only approved for circumferential reduction, preventing one from targeting specific areas of fat removal. Zerona requires between 6 to 10 treatments, which must be performed in the doctor's office. In addition, the results are dependent upon both the use of special diets and nutritional supplements. The next one is mesotherapy. Mesotherapy is a treatment that involves a series of injections of pharmaceutical or homeopathic chemicals for the improvement of a host of different conditions, including fat reduction, cellulite, hair loss, scars, and skin rejuvenation. I am very skeptical of any treatment that claims to treat such a wide variety of unrelated conditions. Although the individual chemicals used in mesotherapy may be FDA approved, the mixture or use of these chemicals to produce such a projected benefit is not FDA approved or sanctioned. The other problem with mesotherapy is a lack of scientific studies demonstrating a reproducible beneficial effect, and more importantly, its safety. Finally, there's liposonics. Liposonics uses a completely different technology called HIFU, which stands for high frequency ultrasound. This heats the tissue, damaging the fat cells and causing the fat to leak out of the fat cells. As a result, patients will experience a burning sensation in the treated area, and it is commonly necessary to prescribe an oral narcotic prior to liposonics to keep the patients comfortable. In addition, liposonics has a greater propensity to produce bruising in the treated area. Finally, there is a specific requirement with liposonics that there is a minimum of 1 inch of fat in the treated area. Whereas Coolsculpting uses an applicator, which will grab a bulge of tissue and expose it to the cooling plates, making Coolsculpting more amenable to areas with larger fat bulges.